Hello, this is John B. with RHEIN Medical. The purpose of this videotape is to discuss the RHEIN 3D diamond blade, as well as a modification which we have made to that blade, which we call the RHEIN 3D Trapezoid blade. The video will be followed up by Dr. I. Howard Fine performing surgery with the new RHEIN 3D Trapezoid blade. First, we're going to discuss the standard 3D diamond blade, as well as the modifications to it. You see an illustration of the RHEIN 3D diamond blade. On the left, the anterior view, and on the right, the posterior view. You can see that the bevels differ from each other. This blade is designed to incise tissue, rendering a perfectly linear, perpendicular incision. You can see that all of the work done by this blade is done by the front bevels above the shoulder. These would be the shoulders. You can see that the bevels differ from the anterior view to the posterior view. This is a front profile of the RHEIN 3D diamond blade. You can see that the sloping leading bevels cause the blade to incise tissue, rendering a linear perpendicular incision. This blade is available on a 2.5, 2.8, 3.0, or 3.2 blade width. It is available on an angled retractable handle as well as a step handle with full retraction, including a preset calibration of 300, 400, or 500 microns to set the groove, as well as full advancement for entrance into the anterior chamber. This is an illustration of the new RHEIN 3D Trapezoid blade. This blade comes in one size, and the dimensions of that size are 2.5 millimeters at the shoulder, graduating to 3.5 millimeters at the base or the mount. This blade is designed to advance through decimes up to the shoulder to accommodate a small phaco tip, and once the surgeon has completed the phaco and IA, the blade is reintroduced into the incision and advanced up to the desired width, all the way up to 3.5 millimeters if that is desired. This particular blade is available also on an angled retractable titanium handle, as well as a step handle, which is designed to allow the surgeon to create a corneal or scleral groove set to 300, 400, or 500 microns, and also the setting for full advancement into the anterior chamber. This is a front profile view of the RHEIN 3D Trapezoid diamond blade. Note that the bevels continue to slope downward, creating a linear perpendicular incision. You see before you the two different diamond knives we just mentioned. The one on the left is the RHEIN 3D diamond blade on a standard angled retractable handle. This handle is designed to be advanced by turning it to the right and fully advanced, and the blade is exposed. And it's also able to be locked by turning it all the way back and locking it into position. The same thing is true for the RHEIN 3D Trapezoid blade. You can see it in the locked position. Just turn it up to the right and forward, and it's completely advanced. And we're going to get some close profile views of both of these blades to show you the different configurations. You see before you both of the blades advanced. The one on the top left is the standard RHEIN 3D diamond blade. The one on the bottom right is the new RHEIN 3D Trapezoid blade. You can see that the one on the left, at the top left, has parallel side edges. However, the one on the bottom right has graduated or trapezoidal edges. The one on the left is designed to open the incision by moving it side to side. However, the one on the right, the RHEIN 3D Trapezoid blade, is designed to open the incision by advancing it forward and backward. Now, if you should have any questions regarding the proper or recommended use of either of these blades, please feel free to contact us at 800-637-4346. Please stay with the video because Dr. Fine is going to be showing the RHEIN 3D trapezoid blade being used in surgery.
A side port incision is made to the left through which a half cc of 1% preservative-free xylocaine is injected. Following that, viscoat is injected into the distal anterior chamber angle and partially fills the chamber as it extrudes aqueous. Provisc is injected under it, forcing viscoat up against the cornea as described in the soft shell technique. The RHEIN 3D blade is advanced in the plane of the cornea until the shoulders measuring 2.5 millimeters reach Descemet's membrane, creating an internal incision of 2.5 millimeters.